In this video, we're going to take a look at how to code for diagnoses and procedures related to monkeypox. So you want to know how to code for monkeypox? Well, you're in the right place, because in this video, I'm going to discuss how to code for the diagnoses, the testing, and the vaccines that are currently available for monkeypox. And we have a sponsor for today's video. Today's video is sponsored by Code. Code provides a platform for you to take advantage of all of your amazing medical coding skills and allow you to work when, where, and how you want. So if you want to take control of your coding career, you want to be your own boss, or maybe you're just looking for some additional income on the side, definitely check out Code Health. You can find them online at codehealth.com. That is code with a K, codehealth.com. Thank you so much to Code Health for sponsoring this video. So let's talk about monkeypox. It's been a lot in the news lately, and it's a viral zoonosis, which means it can be transmitted from animal to human. From what I've read online, it sounds like there are some symptoms that are similar to what we've seen in the past for smallpox, and there are an increase in cases that we are seeing globally in the United States included. Now, according to the World Health Information, this is transmitted a lot from skin-to-skin contact. You wind up with these little lesions. They're more commonly on like your hands and things. And if you come in contact with someone who has them, obviously that's going to spread. It can also be potentially spread by close contact with respiratory droplets with someone who's infected, or even contact with heavily recently contaminated objects. Now, currently in August of 2022, the vaccine supplies are limited, so a lot of places are only giving them out to people that are at higher risk. So people that may have autoimmune disorders, or they may have skin conditions like eczema that would put them at a greater risk of developing something maybe like a necrotizing infection if they were to get monkeypox. Now, we only have one diagnosis code for active confirmed cases of monkeypox, and that is B04. The long description is just monkeypox, and it became effective October 1st of 2021. Now, remember that a patient has to have a confirmed case of monkeypox in order to assign that diagnosis, and confirmation doesn't mean we have to have necessarily a positive test. If the provider documents this patient has monkeypox, not suspected for monkeypox, but this patient has monkeypox, they're formally diagnosing them with it, we abstract that B04 for monkeypox. In the absence of a concrete diagnosis, you would use those signs and symptoms. Typically, it sounds like a lot of things like fever, obviously the lesions, as well as things like swollen lymph nodes. 87593 is the testing code that we have to test for monkeypox. It was made effective July 26th of 2022, so because the CPT books are already in print for 2023, you might actually not see it in your CPT book until 2024. So write that in your book for 2022, and you may need to write it in for 2023 as well. Now, we have two vaccines that are approved for monkeypox. 90611 is for the Jynneos vaccine, which is a smallpox and monkeypox vaccine. It is 0.5 milliliters and distributed subcutaneously. And then we have the ACM2000, which is CPT code 90622. And that is a 0.3 milliliter percutaneous smallpox vaccine. I'm going to put a link in the description to what the AMA has distributed in regards to the monkeypox vaccines. Now, remember, those codes are just for the vaccines themselves, that substance that is getting injected. For the procedure of injecting it, we have to add those admin codes. So if it was a patient that was pediatric and they did counseling of the patient, it would be the 90461, 90462 vaccine administration codes. For adult patients or patients that are pediatric but did not have counseling done, it would be the 90471, 90472 administration codes. Now, let's go over a couple of cases so that you can get a better feel for what we're going to be coding if you come across these. So in case one, the patient comes in and they have lesions on their face and they have lesion on their hands. But after the provider questions the patients, they determine, oh, they thought it was monkeypox, it was suspected monkeypox, but actually they were just insect bites. The patient was at the beach recently and a couple of bugs came up and bit them. So in that case, we're not going to code for monkeypox, but we will code for those insect bites that the patient has on their face and their hand. And of course, we would bill the appropriate evaluation and management service for that location and the level of risk that was documented by the provider. Next, we have a patient that has a fever, swollen lymph nodes, they have pustules, they have fatigue, and they're being tested for monkeypox, and the lab results come back, they're positive for monkeypox. So B04 is our monkeypox diagnosis, and 87593 for the monkeypox test. And next, we have a 50-year-old patient. They come in because they are getting their monkeypox vaccine and they receive that Gianos vaccine. So it's 90611 for that substance, the actual vaccine solution. And then it is a 50-year-old patient, so we're going to use our 90471 for the administration of the vaccine. And that's it. Now you're a pro at coding monkeypox. If you want more coding tips, follow me on Instagram or TikTok at Contempo Coding. I'm posting lots of great content, and some of it's just funny content right there on Instagram and TikTok. As always, if you have any comments or suggestions, feel free to leave them below. I will see you guys in the next video, and until then, just keep on coding on.